If you're over 60, listen closely, because what you put on your plate tomorrow morning could be the reason you suffer a stroke next month. I've seen it too many times. Seniors who seem perfectly healthy until one morning they lose their ability to speak, move, or even remember their family's names. As a brain doctor, I was stunned to realize how many of these strokes are linked to one food nearly every older adult eats: eggs. Eggs can be healthy, but it depends on how you cook them, what you pair them with, and how often you eat them. In this video, I'm going to show you the 5 deadly mistakes seniors make with eggs, why they increase your stroke risk overnight, and the one type of egg that could actually protect your brain. Don't assume your breakfast is safe just because it's familiar. Sometimes it's the normal foods that cause the most silent damage. Stay with me. This could save your life, or the life of someone you love. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Frying your eggs in butter or bacon grease. It's a quiet Sunday morning. You shuffle into the kitchen. The pan sizzles, the smell of butter and bacon fat fills the air, and you crack a couple of eggs, just like you've done for years. It feels comforting, familiar, a taste of the good old days. But here's the terrifying truth. That comfort could be killing your brain. As a neurologist, I've seen this mistake play out far too often and far too late. The problem isn't the egg itself, it's what you're cooking it in. Bacon grease and butter are saturated fat bombs. When they hit your bloodstream, they raise LDL cholesterol, the bad kind, inflame the walls of your arteries, and silently contribute to plaque buildup, especially in the arteries that supply blood to your brain. Now imagine this. Your heart is already working harder in the morning. Your blood pressure naturally spikes as your body shifts from sleep to wakefulness. But now it's fighting thick, sticky blood and narrow, stiffened arteries. That's a dangerous cocktail, the perfect storm for a stroke. Let me tell you about Mr. Raymond, one of my patients. He was 71, sharp as a tack, still gardening, still driving. But every morning for 30 years, he fried his eggs in bacon grease. The way my wife used to make them, he told me. One morning, after finishing breakfast, he stood up, stumbled, and fell. His speech slurred. He couldn't move his right arm. He'd suffered a massive ischemic stroke, and he never walked again. The tragedy? His scans showed decades of arterial damage. The warning signs had been building, slowly, quietly, through habits that felt harmless. What's even more alarming is that most seniors don't feel a thing until it's too late. Stroke doesn't knock, it kicks the door down. It robs you of independence, mobility, memory, sometimes in a matter of minutes. You may survive, but at what cost? A wheelchair, a feeding tube, watching your grandkids grow up from the corner of a rehab center. And all because of what? A few tablespoons of bacon grease in the morning? The danger is real and completely preventable. If you're over 60, your blood vessels are already aging. They don't bounce back like they used to. Every saturated fat-laden meal is another blow to your brain's blood supply. You're not treating yourself, you're rolling the dice with your future. Want to lower your stroke risk starting tomorrow? Put the butter and bacon fat away. Try boiling or poaching your eggs instead. Your brain doesn't need the grease, it needs oxygen, circulation, and care. But it's not just the fat in your pan that's hurting you. It's what's next to the eggs on your plate. And that brings us to the second dangerous habit, adding processed meats like sausage or ham. And trust me, This one's even worse. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Adding processed meats like sausage or ham. There's something nostalgic about sizzling sausage in a pan. The sound, the smell, it brings back memories of busy breakfast before school, Sunday brunches, and holidays with family. For many seniors, sausage or ham next to eggs isn't just a habit, it's tradition. But here's the truth that most doctors don't say clearly enough. Processed meats like sausage, ham, and bacon are among the most dangerous foods you can eat if you're over 60, especially in the morning. Let me tell you about one of my patients, Mrs. Eleanor Ross, a 69-year-old grandmother from Kentucky. She was active, still gardening, walking her dog, and proud to cook breakfast for her husband every morning. But one day, Eleanor collapsed in her kitchen. She had suffered a major stroke that left the right side of her body paralyzed. When I met with her family afterward, her daughter brought in a food journal Eleanor had kept. Every morning, 2 scrambled eggs, toast, and 2 slices of ham or sausage. She thought she was doing everything right. But that processed meat, it was quietly damaging her body for years. Here's why it's so dangerous. Processed meats are packed with sodium, nitrates, and saturated fats. The sodium alone in 2 breakfast sausages can exceed 700 milligrams, which is already half the daily recommended limit for seniors trying to manage blood pressure. Add the nitrates, chemical preservatives used to keep meat shelf stable and enhance flavor, and you're introducing oxidative stress into your bloodstream. This kind of stress damages the endothelial lining of your arteries, making them prone to hardening, narrowing, and clotting. Older adults are particularly vulnerable because arteries naturally become stiffer with age. Many already have undiagnosed high blood pressure. Blood becomes thicker and slower moving, especially after sleep. That means a morning plate with processed meat is creating the perfect storm inside your body. You're spiking your blood pressure, constricting your vessels, and reducing oxygen to your brain, all within the first hour of your day. And here's the scariest part. You won't feel it happening. There's no pain, no warning, until suddenly you lose your balance, your words won't come out right, or your face droops in the mirror. And by then, the damage is done. What's the cost of that harmless slice of ham? It could be a feeding tube because you can no longer swallow, a nursing home bed because you can no longer walk, or the unbearable burden of losing the ability to speak to your spouse or grandchildren ever again. You might tell yourself, but it's just a little meat. And I'll tell you, it's just enough to tip the scale when your brain is already walking a tightrope. So before you lay another slice of sausage on your plate, ask yourself, is that flavor worth your independence? Now, you might be thinking, okay, I'll skip the sausage, but what if I add some cheddar cheese to my eggs instead? That can't be so bad, right? Actually, too much cheese and the salt that comes with it may be even more dangerous than the meat. And here's why. 3. Overloading on cheese and salt. It starts with just a sprinkle, maybe a little shredded cheddar on your scrambled eggs, a dash of table salt for flavor. Seems innocent, right? For many older adults in America, that morning ritual feels comforting, even deserved after a lifetime of working hard and raising families. But what most seniors don't realize is that this simple act may be quietly poisoning their brain. I remember a patient named Walter, age 71, a retired high school teacher from Michigan. He came into my clinic complaining of frequent dizziness and brief moments of confusion, mostly in the morning. His wife thought it was just old age, but I knew better. After a neurological exam and a scan, it turned out Walter had suffered multiple small strokes over several months, tiny events that often go unnoticed but cause permanent brain damage over time. Walter didn't drink. He didn't smoke. He even walked his dog every morning. But when we reviewed his diet, one habit stood out. Every day, he made scrambled eggs loaded with cheese, added a little butter, and topped it all with salt. It was his comfort breakfast. But for his arteries, it was a daily disaster. Let me explain why. Cheese is high in saturated fat and sodium. Most processed or shredded cheeses contain around 200-400 milligrams of sodium per ounce, and many Americans use more than that without realizing it. Add table salt or salty seasonings, and suddenly you're consuming half your daily sodium limit before breakfast ends. Here's what happens inside your body. The sodium increases your blood pressure. The saturated fat contributes to plaque buildup in your arteries. Your blood becomes thicker and harder to pump, especially through the narrow vessels in your brain. This dangerous combination puts enormous stress on your cardiovascular system during the most vulnerable time of day, the morning hours when your blood pressure naturally spikes. For seniors, especially those with hypertension or diabetes, this can be the tipping point that leads to a full-blown stroke or a slow, silent deterioration of your brain health. Many won't feel it immediately, but over time, they begin to lose memory, balance, and coordination, and they don't know why. Walter's story ended with months of speech therapy and lifestyle changes. He told me, "I never thought a little cheese could do this much damage." But it wasn't just the cheese. It was the daily overload of sodium and fat at the worst possible time. And that's exactly how stroke risk creeps up. Not with a bang, but with a whisper. If you're over 60 and still topping your eggs with cheese and salt, it's time to pause and ask, is that flavor worth the future of your mind? But we're not done yet, because even if you cook your eggs perfectly, avoid the bacon and skip the cheese, there's one more silent danger most seniors overlook: eating eggs without any fiber-rich foods. And this one may be just as dangerous. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Eating eggs without fiber-rich foods. For many older adults, a couple of eggs on a plate, sunny side up or scrambled, feels like the perfect breakfast. It's quick, familiar, satisfying. But here's the truth that most seniors never hear. Eating eggs by themselves without any fiber is putting your brain and heart at risk every single morning. I'll tell you about Martha, a 71-year-old widow from Arizona who came to my clinic last year. She was active in her church, volunteered at the community center, and prided herself on eating clean. Her breakfast was simple: 2 eggs and a cup of coffee. No toast, no fruit, no oatmeal. She thought she was making a healthy choice, but what she didn't realize was that this habit was setting her up for disaster. One morning, Martha woke up dizzy. Her hands were trembling slightly, and her speech felt off, just a little slower than usual. Her daughter rushed her to the ER. It turned out Martha had experienced a small but significant ischemic event and a warning stroke. And what triggered it? A combination of poor hydration and a diet completely lacking in fiber. Here's why that matters. Eggs, while rich in protein and nutrients like choline, contain 0 fiber. When you eat eggs alone, especially on an empty stomach, your blood sugar can fluctuate quickly, digestion slows down, and there's nothing in your system to help regulate cholesterol levels or support healthy blood flow. Over time, a low-fiber diet leads to increased LDL, bad cholesterol, higher blood pressure, and sluggish circulation, all major contributors to stroke and cognitive decline. For older adults, fiber is not optional. It's essential. Fiber helps lower cholesterol, stabilize blood sugar, and reduce inflammation in your blood vessels. It keeps your digestion moving and prevents the buildup of plaque in your arteries. Yet more than 90% of Americans over 60 don't get enough fiber, especially in the morning when it matters most. The price of this neglect can be devastating. It's not just about heart disease or constipation. A fiberless diet starves your brain of the nutrients and balance it needs to stay sharp and strong. And the damage? It builds slowly, silently, until one day, like Martha, you wake up and your body no longer responds the way it should. Now, Martha has changed her routine. She still eats eggs, but she adds a small bowl of steel-cut oats or a slice of whole grain toast with avocado and always a glass of water first. She told me, "I never knew what was missing until I almost lost everything." And you might not know either unless you take this seriously. But even if you're getting your fiber, there's one mistake many older adults still make: eating too many eggs each week without keeping track. That might sound harmless, but for some, it can quietly push cholesterol and stroke risk to dangerous levels. Let me tell you why. 5. Eating too many eggs per week without knowing your numbers. There's a saying among older Americans, if it ain't broke, don't fix it. But when it comes to your brain, what you can't see can absolutely break you. Most seniors think eggs are safe, even healthy. And in many ways they can be. They're packed with protein, vitamin B12, and choline, which are all important for aging bodies. But what too many people over 60 don't realize is that eating too many eggs per week, especially without knowing your cholesterol, blood pressure, and stroke risk, can turn a healthy habit into a hidden danger. Let me tell you about Ben, a 66-year-old retired Navy veteran from Florida. Strong, proud, independent. Ben started every morning with 3 scrambled eggs, 7 days a week, sometimes 4 on Sundays. "They keep me full and sharp," he said. But one morning, Ben's wife found him slumped at the kitchen table, alert but unable to speak. He'd suffered a moderate ischemic stroke caused by a clot that blocked blood flow to part of his brain. His MRI showed signs of silent strokes, mini events that had likely been happening for months without warning. When we looked at Ben's labs, his LDL cholesterol was high. His triglycerides were elevated, and he didn't even know, because like many men his age, he hadn't seen his doctor in over 2 years. He thought he was just fine. Egg yolks contain dietary cholesterol, about 185 milligrams per yolk. That's not inherently bad, but if your body already struggles to process fats, or if you have underlying vascular conditions like high blood pressure, diabetes, or narrowed arteries, that cholesterol can contribute to plaque buildup and reduce blood flow to the brain. Over time, this leads to atherosclerosis, which makes it easier for clots to form, the very clots that cause strokes. The American Heart Association recommends limiting cholesterol intake, especially for those at risk. For many seniors, that means no more than 4 to 6 eggs per week, and even fewer if other high cholesterol foods are part of your diet. Ben survived, but the stroke affected his speech permanently, and now he requires help with everyday tasks. He told me with tears in his eyes, "If I'd known those eggs were adding up like that, I would have made different choices." That's the part that hurts the most, when damage could have been prevented with just a little knowledge, a simple checkup, or one less egg on the plate. So before you crack open that next egg, ask yourself, do I know my numbers, my blood pressure, my cholesterol, my stroke risk? Because what you don't know really can hurt you, especially after 60. Now, If you're wondering whether you have to give up eggs entirely, don't worry. There are smarter, safer ways to enjoy them. So what kind of eggs should you be eating instead? Let's talk about that next. 6. So what egg should you be taking instead? After everything I've shared, the butter, the bacon, the cheese, the missing fiber, and the silent buildup of cholesterol, you might be wondering if you need to give up eggs completely. The answer is no. But you do need to choose the right kind of egg and prepare it the right way if you want to protect your brain. I once treated a patient named Helen, age 76, a retired librarian from Oregon. She had always been health conscious, avoided junk food, and cooked at home. But she came to me after her adult daughter noticed she was repeating herself, misplacing things, and occasionally getting confused during conversations. Her scans showed signs of mild vascular cognitive impairment, not full-blown dementia, but clear damage from small, repeated episodes of reduced blood flow to the brain. Helen was devastated. I thought I was eating well, she told me, fighting back tears, and in many ways she was. Except for one habit, she ate 2 fried eggs with cheddar cheese and toast nearly every morning. No fiber, high sodium, and too much saturated fat. Over time, that small decision chipped away at her brain's circulation. That's when I helped Helen build a better breakfast, and it started with a better egg. If you're over 60 and want to enjoy eggs without risking your brain, here's what you need to do. Start with boiled or poached eggs. These methods use no added fats, unlike frying or scrambling with butter. They keep the egg intact, preserve the protein, and minimize cholesterol oxidation, which is what happens when high heat damages the cholesterol in egg yolks, making it more dangerous to your arteries. Next, pair your eggs with high-fiber foods, a slice of whole grain toast, half an avocado, or a small bowl of berries. Fiber helps reduce cholesterol absorption, stabilize blood sugar, and support healthy digestion, all of which contribute to better brain circulation. For seniors with high cholesterol, consider egg whites. They're cholesterol-free and still provide high-quality protein. You can even find liquid egg white products at the grocery store, which are easy to cook and safe for the heart and brain. And most importantly, know your numbers. If you don't know your total cholesterol, LDL, HDL, and triglycerides, ask your doctor. You can't make informed choices if you're eating blind. For many seniors, eating 4 to 6 whole eggs per week is safe, but that only applies if your labs are under control. More than that, and you may be quietly fueling vascular damage, even if you feel fine today. The bottom line is this: eggs can still be part of your breakfast, but only if you respect them. Don't let habit or tradition blind you to risk. Your brain doesn't care how long you've been doing it this way. It only cares what's happening inside your arteries. Helen made those changes. Within 3 months, her labs improved. Her daughter noticed she was more alert, more focused, more herself. It wasn't just the eggs. It was the power of making informed, protective choices. Choices rooted in care, not comfort. And now, it's your turn. The eggs you choose tomorrow could shape the health of your brain for years to come. But that's just the beginning. Because even more dangerous than what's on your plate is what's missing from your routine. There's one morning habit nearly every senior ignores, and it may be the final hidden trigger that pushes your brain toward a stroke. Your morning plate can shape the rest of your life. If you're over 60, every decision you make in the morning isn't just about today. It's about protecting your brain, your body, and your independence for the years ahead. We've talked about the eggs, the way you fry them, what you add to them, and what you eat them with. We've looked at the hidden dangers in sausage and ham, the creeping threat of excess cheese and salt, The risks of skipping fiber and the silent damage caused by eating too many eggs without knowing your numbers. These aren't just dietary tips. They are warning signs, backed by science, rooted in real patient experiences, and meant to open your eyes before it's too late. Because here's the truth. Stroke doesn't usually happen suddenly. It builds quietly, through years of repeated choices, through routines we cling to out of comfort or habit. And all it takes is one morning, one moment when a clot forms, a vessel breaks, or your brain is suddenly deprived of oxygen, and life changes in an instant. I've seen it too many times. The grandmother who now forgets her children's names. The veteran who can no longer dress himself. The husband who speaks in whispers because a stroke stole his voice. And in so many of these cases, they thought they were doing the right thing. They thought their breakfast was fine. They didn't know they were placing stress on aging arteries, inflaming blood vessels, raising their risk every single morning. But here's what I want you to remember. It's never too late to change. You don't need to fear eggs. You don't need to throw out everything you love. But you do need to be mindful, be informed, be willing to let go of outdated habits that no longer serve your aging body. Start simple. Boil instead of fry. Swap the processed meat for greens or berries. Cut the salt. Eat fiber. Drink water. And most importantly, know your numbers. Talk to your doctor. Ask questions. Don't guess when your brain is on the line. Because the greatest tragedy I see in my clinic isn't stroke itself. It's when someone suffers a stroke they could have prevented. So tomorrow morning, when you stand in your kitchen and reach for that frying pan, I hope you pause. I hope you remember this message. I hope you choose differently, not just for your breakfast, but for your future. Because your brain deserves more mornings. And it starts with the choices you make today. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.